Baystate Medical Center is offering a new procedure which will reduce the stroke risk for people with the irregular heartbeat condition, atrial fibrillation, otherwise known as AFib. I sat down with cardiologist Dr. Amir Lotfi from Baystate Medical Center, who explained the procedure and the benefits.
Atrial fibrillation is an arrhythmia that occurs on the top part of the heart. Normally, your heart is very synchronous. Top part fires, bottom part fires. In atrial fibrillation, the top part of the heart starts to begin to beat very irregularly and fast, which therefore makes the bottom of the heart beat irregularly and fast. Surprisingly, up to 40 to 50% of the people who have atrial fibrillation don't even feel it. But some of the symptoms could be when they check their pulse, it's fast and irregular. They feel short of breath with activity because suddenly their heart rate shoots up. Sometimes they might have chest pain or lightheadedness. And downstream, they finally discover they have atrial fibrillation.
So what causes it?
Atrial fibrillation is one of the most common statistics you will see is related to age. As we grow older, up to 1 in 9 people over the age of 80 can have atrial fibrillation. So that's why it becomes very common. The theory is as the top part of the heart over time, just like any other part of the body, goes through wear and tear and has abnormal tissue forming, and the electrical circuit begins to get impacted and starts randomly firing.
So this can cause a stroke, for example.
So when you have an irregular heartbeat on the top, when it's not beating in a regular fashion, there's a part of the heart on the top left side called the left atrial appendage, which is a little sac that comes off of it. The blood can stagnate there. The stagnation can form into a clot. The clot can get dislodged and cause a stroke. So atrial fibrillation, as I described, because of the irregularity, one component is the symptoms, and the other component is it significantly increases your risk of having a stroke.
Okay. Currently, what is the common way to treat this?
Right. So medications, or sometimes you see our electrophysiology colleagues, they talk about ablation or medical therapy for the fast heart rate. For the stroke part, you talk about medications like Coumadin or warfarin, or their newer generation of medications that you don't have to check your blood test, that thins the blood, that reduces the chances of having stroke by up to 70%. And so that's the medication route. Now we have a procedure route in people who can take long-term blood thinning medication, and the device is called a Watchman. It's a device that looks like a parachute or a jellyfish that kind of fits into that little appendage I talked about, where most of the time the clot forms. And by sitting there, your own tissue kind of grows over it and prevents clot from forming there.
And this is something that can be done, in the hospital, but it's a laparoscopic procedure?
Right. It's what we call a percutaneous procedure. We go from the groin, from the vein, we go up, we go onto the right side, and then under ultrasound, we go with a needle to the left side of the heart, identify the little pouch, make sure it's the right size and depth, and at that time pick the right device to implant there.
So that implants, and then how long does it typically take for your own tissue to grow over that, and what do patients do in the meantime as far as controlling their condition?
So, excellent question. So what happens is after we do the implant, you go on a blood thinning medication like Coumadin type for 45 days. Then you have a repeat ultrasound. If that area looks good, then you come off of your Coumadin. And you stay on 2 other blood thinning medication, aspirin and clopidogrel, for a total of 6 months. And if you're doing good there, then you stop the clopidogrel and just remain on aspirin.
What's a drawback from the blood thinning medication for patients?
The biggest drawback, and the main reason we get consulted for this device, is bleeding. With any procedure or medication, there's always a risk and a benefit. And what I always tell patients is, as long as the benefit outweighs the risk, then that's something you should consider. So the downside of blood thinning is bleeding. And we see people who have bleeding from their stomach or bowels or brain, and they can take long-term blood thinning medication, but they're still exposed to the increased risk of stroke.
Okay, and who is not able to have this procedure done? Is there somebody who might have AFib who would not be qualified, to have this procedure?
Excellent question. So this date in 2019, we're not very good at identifying who's going to have a stroke or who's not based on just having atrial fibrillation. So we use a risk score based on your age, gender, congestive heart failure, diabetes. All these numbers are added up. So if your risk score is 3 points or less than 3 points, then you shouldn't really get this procedure. The higher the risk score, it seems the more benefit you can have. The other group that might not benefit from this procedure is anybody who has an infection. You don't want to implant a device in. Anybody who you worry about continuous bleeding, because we do have to put you on a short-term blood thinning regimen. These are the people we are very careful on.
And this is not for somebody who has a heart valve problem? Is that
No,
true?
we can, yeah, correct. If somebody has, if their cause of their atrial fibrillation is typically due to mitral stenosis or narrowing of their mitral valve, or regurgitation, severe leakage, those people are usually excluded from the studies.
And how long does it typically take, for somebody to go in and have this procedure, and how long are they in the hospital?
They come in the morning, they have their procedure. If everything goes well, they go home the next day.
Wow.
Yeah.
So as a cardiologist, all of these different advancements in surgery, and, where you don't have to do open heart,
Right.
this, you've seen, I'm sure, so much through the years in your career. This has to be exciting for you.
No, it's exciting because what it does, it allows us to provide therapy within our own community. So Baystate allows these advanced therapies to be provided in our own community where our patients can have access to that expertise.